ऐसा किया तो फेस बराबर आता है. Hi friends, we are back again with you with this Facebook live session, and today I have brought along with me my very dear friend and our neonatologist who's there for each and every delivery of yours, that is Dr. Jesal Sheth. And together we are going to talk to all you lovely girls about what to expect and what should I do when I come for my delivery. So today's topic is, what should I anticipate when I come for delivery? So the way we'll do it is, I'll ask few questions what would commonly be in your mind, and we'll try to give the answers to those questions. So very often all my patients, all of you are asking me, when you come closer to your due date, expected date of delivery, that ma'am, what exactly should my bag contain? What all should I be bringing to the hospital? So actually the answer to this is very, very simple. Really, we don't want you to bring anything else except yourself, that is wholeheartedly the patient, as well as her important documents. So frankly, that is all we need from you as a health personnel, and anything else that you wish to carry is something that makes you comfortable. Whether it is all the stuff that is required for your delivery, or for the newborn baby, or for whatever period that you're going to stay in the hospital for the next 3 to 4 days, all of that is provided by us at Fortis Hospital, Mulund, and we do not wish, or we do not require you to bring anything additionally. So your maternity bag should really contain your file, your reports, all your important documents that we have summarized through the 9 months, and you should come carefree and without any concern to the hospital. Of course, every delivery, every birthing process is absolutely unique, and it is so difficult to plan or program, what is going to happen. But still, let us understand. A lot of you will ask me the next question, ki, doctor, how will I know? How do I know that I'm ready for delivery? What am I supposed to feel? What are the things that will really happen to me? So, if I were to tell you that some of you could feel what is called as quickening, or the baby drops. That is mainly what you feel when the baby's head kind of engages into the pelvis. So the size of the womb, the size of the uterus actually drops down, but you start feeling more pressure in the pelvic region. You start wanting to pee more frequently. There is a feeling of fullness in the vagina, or pressure in the vagina. So you may feel some quickening. You might notice some vaginal show. What is show? Show is really some pinkish discharge or bleeding that some of you may have. Sometimes you may notice like a mucus plug. Either the whole mucus plug would shed, or it would come out in the form of mucus discharge, and this can happen even couple of days or a week before your delivery. Now, some others may actually feel some symptoms which you may not really correlate with the delivery process. For example, you may feel sudden loose motions. There might be a sudden severe nausea. The nausea that you had in your first trimester, you had absolutely overcome in the second trimester, and now suddenly you're very nauseated, or a lot of you may even start puking or vomiting. But these can all be symptoms of going in labor. Of course, you may feel some tightness in the abdomen, pain, backache, and some of you may also experience what is called as the water bursting or the leaking. So these are all the signs. These are all the important things that you have to keep in mind. And when anything like that happens, you must be in a position to come to the hospital at the earliest. Another thing that, a lot of patients want to know, or they ask us, is like, what are really the stages of labor? I mean, what am I experiencing, or what am I actually anticipating in the time that I come to the hospital. So if I were to simplify, let me say that labor is in 4 stages: stage 1, 2, 3, and 4. And this first stage starts off with something which is called as a latent labor. What is latent labor? That means your labor has started, but the symptoms are not yet that pronounced. That means you are getting pains, but the pains may not be so strong. The pains may not be very, very frequent. So this is where the mouth of the uterus, that is the cervix, has just begun opening, and it may open to admit about 1 or 2 fingers. So this is the latent phase of the first stage. And the active phase of the first stage will be when the cervix opens completely till full dilatation. Obviously, your contractions, your pains are going to become much, much stronger. You are going to start feeling a lot of pain during the contraction, and the contractions will become much, much regular. For example, if we were to look at 10 minutes, a woman in active phase of labor may experience labor contractions. 2 to 3 times she may have good contractions, which may last even about 35 to 40 seconds, and then she may relax, her uterus may relax in between, and another 2-3 minutes again she will start developing the active contraction. So this is the first stage of labor, and it starts with the onset of labor, and it is completed when your cervix or the mouth of the uterus has dilated fully. The second stage of labor is what we typically imagine or think of labor, where your cervix is fully dilated, and now we are going to ask you to bear down or push. So this is the second stage, from the complete opening of the cervix to the baby being delivered. The third stage of labor is when the placenta and the afterbirths are delivered out, and if there is any episiotomy or any sutures that need to be taken, all that will happen in the third stage. And the last, or the fourth stage of labor, is the period of where we are observing you for an hour or 2 after your labor process, and that's when we are monitoring to see that you have definitely gone through labor well, and your body has kind of adjusted with this entire process. Now, a lot of you ask me when you come during your last antenatal checkups, that doctor, what if I cannot do something? What am I supposed to know? Like, can you tell me something that I can learn and come? So I think of this as as a absolute natural reflex, and I tell my patients often that even when we are small kids and we are actually getting when we need to pee or when we need to poop, definitely our mom is potty training us. She's training us where we should go and release our contents, but no one really needs to teach us how to poop, right? It's a natural instinct. So I very strongly believe that even when it comes to delivery or actually bearing down or the labor process, it's an absolute natural reflex. And I don't think anything needs to be taught or anything needs to be learned before you come to us. So basically, in fact, I tell my patients that please don't come with anything learned, because we will have to make you unlearn all of that. So we just want you to come with a clean slate. And I tell my patients very often that, can you hear when I tell you something? And they say yes. And I tell them that, can you follow instructions? And if you are able to do that, right, Jesal? So like we tell them, if you are just hearing us and you are just following the simple things that we are telling you, like I'm telling you, please lift up your legs, or please take in a deep breath, or please hold your breath now. Okay, come on, now just push hard, push as if your stools or motion is stuck and you want to just get it out. And that's all that you really need to do. Of course, if anyone of you want to prepare and, feel confident, I would definitely encourage all of you to practice deep breathing exercises, and not in the last month or the last few days, but that is something that you must do throughout pregnancy, so you have increased your lungs capacity and you will be able to push down very, very well. So now that we know the stages of labor, let's really come to pain relief, because all of you are mighty worried and scared about, doctor, will I be able to bear the pain? The husband is telling me that, doc, she's so delicate, she cannot take even this much of pain, and how the hell is she going to go through that? A lot of you are telling me that, please don't put me through this, just get me relief, do a cesarean and deliver me off. So when it comes to pain relief, we have painkillers which we can give you throughout labor. Of course, we have what is called as epidural anesthesia. It's a simple type of anesthesia where we insert a tube in your back and we are giving you injections through that tube, and as a result you will not feel the intensity of pain. Meaning what? You will feel the contraction, you will realize, but the intensity, the severity of the pain that you are feeling will get reduced. As a result, you will be lot more comfortable, and you may see, because labor can sometimes stretch for hours. Sometimes it may be there for 5, 6, 7 hours, and someone may tend to get completely exhausted. So we want you to be comfortable. We want to make you as pain-free as possible so you can do well when it comes to pushing your baby out. So whether it is the painkiller injections that we give you, or we can give you what is called as painless or epidural anesthesia, and make your delivery process very smooth and comfortable. What are the other do's and don'ts that you must follow? Well, make sure you're well hydrated. Maybe you're not able to eat, but at least take a lot of liquids. Of course, this has to be with the permission of your doctor, because if they are worried about something, they might be thinking of a cesarean, they may restrict your intake. The second thing can be, make sure you are comfortable walking about, again with epidural. If we have given you the epidural injection, then sometimes it may not be so easily to walk about, but still we'll want you to be comfortable, move, turn in whatever positions you are. Also, make sure you don't hold your urine, or if you have a sensation for passing motion, please go ahead and do that. Don't hold those things, because those things will make you much more uncomfortable. Also, I often tell my patients that sometimes it is not so much the pain, but it is the fear of what is happening around you. As a result, what happens? We tend to freeze. We just see a simple small injection. How much pain does that cause? Hardly anything. But I've seen patients who just freeze seeing the needle. So what happens? Your entire body is got rigid and you have completely exhausted yourself in that entire experience. So the same with labor pains. If you are terrified, if you're mortified of the labor pains, then what happens is that, of course, you are in pain and you are trying to cope with that, but the anxiety and the stress of this entire situation completely tends to exhaust you. And then what happens is, when we tell you you're ready for delivery and we want you to push and we want you to bear down, and that is the time where you are completely exhausted. So I tell all my patients, just try and be relaxed. And yes, when you get a contraction, please try to distract yourself by counting numbers or saying something. But in between the contractions, when the pain has gone, try to relax and make yourself more and more comfortable. Of course, we are going to do tests on you. We are going to take some blood samples. We are going to monitor your baby's heartbeat continuously. We will be doing what is called as the CTG, or the continuous tachography, where we are monitoring and seeing that your baby's heartbeat is absolutely comfortable and fine. Let's now that you have delivered, let's say, and what are the things that we are looking post delivery? Well, post delivery, yes, there might be some sutures and we'll give you some pain relief for that. Also, make sure you empty your urine and your bowels well. Don't be scared, because the suture line is far away from these two openings, so one need not be worried about passing urine. And of course, the most important thing that we are going to focus on as you have delivered is trying to let your baby and you bond, because that is the most beautiful moment for us as well as for you. And there comes in our very competent and very lovely neonatologist who's always there by your bedside, and she comes and she announces, hello Mrs. X, you have a princess, and then she's going to bring the baby to you and encourage breastfeeding. So I'm going to ask Jesal a couple of questions today. So Jesal, how do we ensure that these women who are delivering, they establish successful breastfeeding? Because I think that is a big worry or challenge, So yeah.
Thank you, ma'am. Yes, I think as a doctors in the hospital, this is the particular branch. The birth of the baby is the only thing where people come to celebrate in the hospital, because in all the other branches people are unwell and they seek for the medical treatment. This is the branch where people come and create memories also with us. So that's where we always enjoy working around it. Yes. So once the baby is delivered, what we do is we examine the baby. We see that baby is dry, baby is breathing fine, breathing rate is not fast, and baby is maintaining good oxygen levels. Once we ensure that, then we actually hand over the baby to you. And we request you, depending on your physical condition, whether you can start putting the baby to latch or not. The initial part of the milk, because this is a very common thing, everyone says मैंने खाया नहीं है, so I'm not going to get the milk, but that is not true. As soon as the placenta is cut, the hormonal changes happens in the body, and your breast is ready to release actually the colostrum, which is a very important thing for the baby's nutrition. It is very rich. The quantity of the colostrum is going to be small, but it is very rich in the multiple things like nutrition, calories, the immunity factors, and the taste of the pleasure of the life is the taste. So very sweet in the taste. So we say as soon as the mother is ready and madam is ready to hand over the mother to us, we hand over the baby to the mother, and we try to put the baby on the breast. Now many times people say how do I know, how do I prepare, how do we feed the baby? So that is also the same thing. I think in the all the branches we say, I think mother doesn't know how to feed, but baby knows how to take the milk. So we first put the baby to latch on the breast, allow the baby to suckle well. If we see that the process is not happening, or if there is a problem with the nipples, like nipples are flat or breasts are small, breasts are empty, baby is frustrated, then we go and intervene it, and we explain you the technical part also, which happens actually. And in terms of the baby and the mother, everyone takes a little bit of the time to understand the preferences, because even if it is the same mother and delivering second time, but baby might have a different preference and different method of adjusting with the mother. But what we can do is we must always try. We do see that nowadays the mothers go in the lactation failure, some sort of the partial lactation failure. So if that is not the case, we don't offer the formula unless if we think that yes, mother's milk production, body's milk production is not matching with the requirement of the baby or thirst of the baby. That is the time, then and then only we offer the formula. Now the troubleshootings, I think in the first day, basically we ensure that there is no problem in terms of clinical examinations. All the facial features, limbs, whatever we see out from outside is fine. Whatever we can auscultate, we see that heart is fine and all. If there are some problems, medical problems with the mother before the delivery, then we anticipate the problem, so we monitor for that. For an example, if mother has a diabetes, which is a quite common problem, mother has a hypertension, or mother has any other medical problem, then we do observe these babies from that perspective. But if that is not the case, in the regular normal delivery, we just go with the baby and allow for the smooth transition. We basically try to encourage you to allow the baby to suckle more and more, because more and more the breast receptors get stretched, the body produces more milk. So if we do not allow it, or if mother doesn't allow it for any medical reason, then the lactation will still be established, but there might be some little more time to actually get established. Then the mothers ask various questions. How do I know that my milk is sufficient? Is the baby getting enough milk? Baby is not hungry, kind of the question. So what we say, you don't have to worry much. You just look at the baby. In the absence of any medical factors, baby should be fed on demand. And in the first few days, babies sleep most of the day, except the time when they are uncomfortable or the diaper is wet or they are hungry. Otherwise, they sleep, they eat, and they sleep. So if the mother has a less quantity of the milk, then what happens? Baby will be passing less urine. Urine may become yellow. Not only that, sometimes baby becomes very irritable and gets up to eat very frequently because the quantity is small. But that we come to know through the baby, because we cannot quantify, ever how much is the production of the milk in the mother's breast and how much baby needs, because these are two different things which we cannot quantify. So if we see that after, putting the baby on the breast, after good amount of the suckling and latching experience, if baby is still, thirsty or hungry, then only we come to know. Or baby is waking up every half an hour to eat, not looking happy, then we go and intervene. Otherwise, if these things don't happen, then we don't go and look for the problems. Other common things which we see is, sometimes babies may have some kind of the different of the crying voices, and these are non-verbal babies. They are dependent babies. They can't talk. Even we can't talk. Like, we don't know birds' language. We don't know baby's language. So what we do is we go and observe the baby very carefully, because babies cry only if there is a discomfort. So we try to observe which part of the body of the baby looks uncomfortable and try to address it. For an example, sometimes baby have a lot of grumbling before they pass his urine or the stool, because they find it uncomfortable. And once we passes the stool or the urine and we change the diaper, they settle down. If the baby is hungry, hunger is a survival instinct. So baby cannot settle down if baby is hungry, because baby is capable to tell everyone that I'm hungry, please feed me. So these hunger cries are very loud, they are unconsolable, and they go on and on. So in that case, if this happens, we would know, because these cries are not consolable, and that you give the milk and then only baby becomes quiet. So these are the things we look forward for. We quite often say that the babies develop little bit of the jaundice after the birth. This is a very different type of the jaundice. This is not because of any swelling in the liver or infection in the liver. This is a part of being a neonate where organs are still maturing. So because of which we see a little bit of the jaundice. So if we see there is a concern, if there is a medical risk factor, like mummy has a O positive and baby has a ABO positive group, or mummy is RH negative and baby is RH positive, if we see this kind of the risk factors, we anticipate. And in that case also, if we see that the baby is developing jaundice faster, the tinge is becoming more and more deeper, in that case only we do the blood test to see baby needs any kind of the treatment or not. But otherwise, in most of the babies, it is a physiological jaundice. It starts from the second day of the life and it vanishes by day 4, day 5. So most of the time we don't do anything about it, we just observe them. So these are the main troubleshootings which we see. Once in a while, if we think that baby has some startling response, that the babies are quite normal, but if we see that they are excessively startling, in that case we do go and check the sugars as well as the calcium levels. Again, we do it if it is required, but if nothing happens, then basically I think all pediatricians prefer to touch the babies very less and allow them to have good amount of the nutrition, and then basically grow well. Many times mothers also ask that how would, so all those mothers who have some sort of the partial lactation failure, where her body is not producing the milk as much as what baby needs, and those babies who require supplemental milk in the form of formulas, they also ask, how do I know? So we always say that, okay, this is a temporary situation, because the lactation failure will improve in a day or two. So every time, first you put the baby on the breast, allow the baby to suckle, and then if you think that baby is still not satisfied, then and thinly offer some formula milk. But in that case also, once the mother's body makes good amount of the milk, baby will start spitting restricting the formula milk. The reason is the human milk is extremely sweet. So your baby will tell that now you don't give me, I don't need anything else, because mother's body is making a good amount of the nutrition. We also actually engage, in the Fortis Hospital, we have a big team. We have dietitians. We encourage the mother and explain again to take plenty of the galactocoaches, liquids, mobilize them out of the bed very quickly. So all those things are also very important for the good recovery, faster recovery, because once the mother recovers, the body starts healing. That also contributes to establish very successful lactation in the mothers. And now, since we are in this 21st century, we all believe in preventive medicine. We do not want to anticipate the complications after it happens. We don't want to diagnose many common diseases after we see it clinically. So as a part of the preventive screening, we also suggest you to undergo a newborn screening, where we can actually diagnose prevalent common medical conditions in the babies by just using a drop of the blood with the heel prick. So this is something we suggest. If possible, we do it, and we can actually, if it comes positive, then we can actually start anticipating more problems, and accordingly we can do good counseling. We also offer hearing screening to all the newborn babies. This is another, we follow universal hearing screening program. So we advise and screen all the babies for their screening before the hospital discharge. We also check their oxygen levels when they are in the hospital, and the most important part for the babies is the vaccination. So in the absence of any medical problem, we normally vaccinate the babies in first 24 hours of the life, and probably we not wait for the 24 hours also. We just vaccinate the baby within the few hours after the birth, which is very important. There are 3 birth vaccines: BCG, polio, and hepatitis B, which all the babies receive before they in the first 24 hours of the life, unless there is any medical reason to delay the vaccination. So these are the routine care which we do over here. We do as a team, and basically good pain control, faster recovery, out of the bed mobilization, good galactocoaches on the board, not having a good everted nipples, and the determination of the mother actually helps to establish a very successful lactation and breastfeeding, which is basically a pleasure of the life for the mothers. So we actually attempt to send every mother home, every baby home on the exclusive breastfeeding.
Absolutely.
That's what we have.
I was just going to say that we have a very, very high rate of our patients who've delivered with us who have gone home successfully breastfeeding. And when they come to me for the first follow-up, that is after 8 days, for a routine checkup, one of the questions that I ask them is, are you feeding the baby well? And almost all of them have said that they are now confident mothers and they are feeding well. And of course, I'm not being able to get the rest of the team here, but while you are with us for delivery, we have a physiotherapist who's seeing you and giving you exercises. We have a dietitian who is catering to your diet. We have an excellent lactational counselor who's giving you pearls of wisdom on breastfeeding. We have excellent trained nurses who are always there at the bedside, and very often that is what I tell my patients. The way the nurse is wrapping your baby, the way she's holding it, the way she's burping it, I want to see you doing all of this, and that is going to be my point where I'm going to say, great, you're fit to go home. So we, including Jesal, myself, and all our team members, with all our resident doctors, of course, I cannot forget them, who are painstakingly there by your side all the time. So yes, we work very, very harmoniously in making sure that your delivery and your baby's birth is the most beautiful journey of your life. Thank you.